It might be time for a makeover. There's a new procedure that's giving many women the look they want, but minus the turnaround time. It's called Slimlipo, and with me now to talk more about the procedure is Dr. Drew Varano from Cosmetic Enhancements. Thank you, Drew, for joining us.
Thank you for having me.
Lipo's been around forever. How is this procedure different from that traditional liposuction we've heard about and seen so many stories on before?
Well, there's been advancements in terms of liposuction. There was what's called power assisted, then ultrasound, then laser came on the scene a couple years ago. Not all lasers are created equal, and with this new technology we're able to more effectively melt fat that was even available a couple years ago. So with this procedure we can get the melting of fat, we can also tighten the tissue at the same time. It gives us the benefit of using what's called tumescent anesthesia, which is local anesthesia, so patients are not completely out. It's known to be a lot safer that way. So with that and the less manipulation that's done, patient recovery is a lot quicker, where I have patients that are back at work about 2 days later.
And that's what we actually have some pictures, I believe, that we were going to show. And this is actually someone you treated. And 2 days, is this right? Or no, 5 days before
This is
and
an arm treatment that I did just about 2 weeks ago, and this is how much tightening and contraction she had in her arm in a matter of a few days. You can see that she does have a little bruise there, but that will go away in a couple days. And I do have patients that don't even bruise from the treatment.
I know, and that's one of the things they're saying Slimlipo has as far as advantage-wise, the pain involved in it, the whole process.
Yeah, well, when we utilize tumescent anesthesia throughout the procedure, most people have minimal pain or discomfort. I ask them to rate on a scale of 0 to 10. Most people give me a 1 or a 2. You can see right here that we're using the laser to melt the fatty tissue, and you can see it can be done in the dark. It's helpful where the anesthesia is put along several incisions, less than the size of a pencil head.
How does that compare to regular lipo? I mean, do they usually cut it open?
Well, it depends on the candidate that's done, but the incisions can be greater where there's suturing done at the end. In this case, we don't do any suturing at the end. There's a little bit of drainage that will happen over the next 24 hours, so they heal with more of a natural process.
And it's important to note that this is not a substitute for diet and exercise, and not everyone is a candidate for this procedure.
Exactly. Like all forms of liposuction, the best candidates are those who are close within their body weight, that just have a few pounds that they need to get off, whether it be love handles, abdomen, thighs, or even neck area or arms, as we had showed.
So zeroing in on one target spot.
One target. We can do multiple targets during the treatment session.
What is the gauge? Is it 25 pounds overweight?
You want somebody within about 15 to 20 pounds of their ideal body weight.
Okay. And when we talk about the risks involved, we know that every surgery has them.
Every surgery has risks. With using tumescent anesthesia, it's a lot safer than using general. In terms of this, things that we look for, I mean, people will have some swelling for about 10 days or so. You can have some bruising. The areas that the incisions were done, some people can heal with a little numbness or tingling in that area, but that all resolves within about a month's time.
There's a variety of different procedures like this that have popped up where you have to revisit and you pay every time you go, but you're saying this is a one-time deal.
That's correct. This is a one-time deal, and once it's done, the fatty tissue obviously is removed. And over time the skin will contract. The results aren't seen immediately. They're usually seen within about 3 weeks. You can start to see some improvements, but you do improve over time. By about 8 weeks you notice the majority of improvement, and even by 6 months you can have a little bit more improvement.
What are the costs involved for a procedure like this?
We break it up in terms of areas that are treated, but in general it's somewhere between $3,500 and $5,500 per session.
Does insurance cover a procedure like this?
No, insurance doesn't cover.
Wow, pretty pricey endeavor. Well, thank you for telling us a little bit more about Slimlipo. We're going to have this video up on our website, WUSA9.com.